Will masturbating make you go blind? Will it tank your testosterone? And the biggest question I get as a urologist, how much is actually too much? My name is Dr. William, and I'm a board-certified urologist. In my line of work, I've heard every myth, fear, and question you could possibly imagine about this topic. There's just so much misinformation out there, and it's usually wrapped up in a whole lot of shame and guilt. So today, we're going to fix that. We're going to replace the myths with medical facts. We'll tackle the biggest misconceptions head on, and by the end of this, I'll give you the real clinical definition of too much and what that means for your health in the long run. Section 1. Let's address the shame in the room. Before we get into the myths, we need to talk about why. This conversation is so important. For centuries, masturbation has been taboo, shrouded in cultural and social warnings that have almost nothing to do with health and everything to do with control. A lot of people carry around this deep-seated guilt, feeling like they're doing something wrong or damaging to themselves. So let me be crystal clear. From a medical point of view, masturbation is a normal, healthy, and perfectly safe sexual activity. It's a natural way to feel pleasure, blow off steam, and learn about your own body. My goal here isn't to judge, it's to educate. I want to give you the power of knowledge so you can let go of the shame and understand your body from a place of science, not fear. Section 2. Myth number 1. The oldest lies, blindness and hairy palms. Let's start with the greatest hits, the myths used to scare teenagers for generations. Masturbating will make you go blind, or it will cause hair to grow on your palms. This is, and I can't say it enough, 100% false. There is zero scientific or medical evidence to back up either of these claims. They're old wives' tales, plain and simple, from a pre-scientific era, designed to create fear. I mean, think about it. If this were true, a huge percentage of the population would have terrible vision and very, very hairy hands. These claims belong in the medical history dustbin, so let's leave them there. Section 3. Myth number 2, the big one. Masturbation will ruin my testosterone. This is probably the number one concern I hear from my male patients. The worry is that every time they ejaculate, they're losing precious testosterone, which they think will make them weaker, less masculine, or hurt their gains at the gym. Let's look at what's actually happening. There's no scientific evidence that masturbation has any long-term negative effect on your testosterone levels. In fact, for a short time, the opposite happens. During sexual arousal, your testosterone levels actually get a temporary little boost. After orgasm, they just return to your normal baseline. Think of it like sprinting for a bus. Your heart rate spikes for a minute, but it doesn't stay that way forever. It quickly goes back to its resting rate. Your hormones work in a similar way. They're built to handle these temporary changes. It doesn't use up or deplete your testosterone. This means it has no negative impact on building muscle, your energy, or your overall health. The idea that holding off makes you stronger is a historical belief, not a medical one. Section 4. Myth number 3. It causes erectile dysfunction, ED. Another common fear is that masturbation, especially doing it a lot, will cause erectile dysfunction and make it hard to perform with a partner. This myth isn't just false. The reality is often the complete opposite. Being able to get and keep a strong erection during masturbation is actually a good sign. It tells you that the physical plumbing, the blood flow and nerves are all working just fine. But there's a really important distinction to make here. The issue isn't the act of masturbation itself, it's often the context around it. For many younger men, the real culprit behind erection issues can be an over-reliance on pornography. Here's why. Constantly watching porn can set unrealistic expectations for sex and partners. It can desensitize your brain, which means a real-life person might not seem as exciting as the super high novelty stuff you see online. This can lead to performance anxiety. You get so worried about living up to what you see in porn that it creates a psychological block. So, to be clear, masturbation does not cause ED, but a compulsive relationship with porn can absolutely contribute to psychological erection issues. Section 5. Myth number 4. it means my relationship is failing. A lot of people think that if they or their partner masturbates, it must mean there's a problem in the relationship, a sign of dissatisfaction or a lack of intimacy. This is simply not the case. People in happy, healthy, and sexually active relationships still masturbate. It's a form of personal sexual expression. It's a way to de-stress and stay in tune with your own body and desires, which can actually improve your sex life with a partner. It's not a substitute for partnered sex. It's just a normal part of a person's individual sexuality, whether they're single or not. Section 6. The core question. How much is actually too much? All right, we've busted the big myths. So now we get to the main event, the question everyone really wants answered. How many times a week is okay? Is there a magic number? Here's the definitive medical answer. There is no universal number that defines too much. Whether someone does it daily or once a month says nothing about their health by itself. The frequency is not the issue. From a clinical standpoint, masturbation only becomes excessive or a problem when it starts to negatively and tangibly get in the way of your life. The World Health Organization's ICD-11 includes a diagnosis called compulsive sexual behavior disorder, and it isn't defined by a number, but by negative consequences. So, how do you know if it's a problem for you? Ask yourself these 3 critical questions. Is it interfering with my life and responsibilities? Are you skipping work, school, or important time with friends and family to masturbate? Are you neglecting your own hygiene or other parts of your life because this has become your main focus? If yes, that's a major red flag. Is it causing me physical harm? This one is pretty direct. If you're masturbating so aggressively or so often that you're causing skin irritation, chafing, swelling, or pain, your body is sending you a clear signal to ease up. In very rare cases, aggressive techniques can even lead to Peyronie's disease, which is a buildup of scar tissue. Pleasure should never be painful. Is it causing me significant mental or emotional distress? This is the most important question. After you masturbate, do you feel an overwhelming sense of guilt, shame, or anxiety? Do you feel a total loss of control? Like you have an intense urge you just can't stop, even when you want to? Do you keep doing it even when you get little to no satisfaction from it anymore? If your behavior is causing you this kind of distress, that's a sign it's crossed over from a healthy habit to a compulsive one. If you answered no to these questions, then from a medical perspective, whatever frequency you enjoy is perfectly fine. Section 7. The upside. Are there actual health benefits? Not only is masturbation harmless for most people, but it also has a bunch of proven health benefits. Orgasm releases a fantastic cocktail of hormones and brain chemicals like dopamine, endorphins, and oxytocin. This can lead to serious stress relief, a better mood, improved sleep, and can even help with body image. On top of that, a growing body of research suggests a link between frequent ejaculation and a reduced risk of prostate cancer. One major study found that men who ejaculated at least 21 times a month had a significantly lower risk of developing prostate cancer compared to those who only ejaculated 4 to 7 times a month. The theory is that regular ejaculation might help flush potentially harmful stuff out of the prostate. While we still need more research to say for sure, the evidence is pretty promising. So, let's recap the facts. Masturbation is a normal, healthy part of human sexuality for the vast majority of people. The old myths about it causing blindness, destroying testosterone, or leading to ED are completely false. The only time it becomes too much is when it starts causing real-world harm, getting in the way of your job or relationships, causing physical injury, or leading to serious emotional distress and a feeling of lost control. If you're not experiencing any of that, you can officially let go of the guilt and stop counting. Your body and mind are fine. Thanks for taking the time to learn the medical facts today. If this video helped clear things up for you and you want more shame-free, science-backed health info from a urologist, make sure to subscribe and hit that notification bell. Knowledge is the best medicine, and if you have a question you'd like me to tackle in a future video, drop it in the comments below. Stay healthy and be well.